Okay, good day, ma'am. I am Powell James C. Tabogoc, a student nurse from the University of Eastern Philippines, and I'm here to assess your mouth, throat, nose, and sinuses. Okay, so for verification, ma'am, please state your name, age, and date of birth.
I am Diana Janelle Belmonte, 18 years old. I was born August 18, 2002.
Okay, so what is your preferred language po, ma'am?
English.
Okay, so we will use English as our language of communication. So, again, ma'am, I am here to assess your mouth, throat, nose, and sinuses. And in order to do that, I will be touching some parts of your body. Will that be okay, ma'am? Okay, so I assure you, ma'am, that the findings and documents will be kept confidential between me and the attending physician that I will be referring you to. Okay, so before we proceed to the assessment proper, let me ask you these questions first, ma'am, in order to gather subjective data that will be helpful in making a diagnosis. Okay, so the first question is, do you have any mouth problems? Does your mouth sore or does it have lesions? How about bleeding, swelling? Okay, how about in your gums? Do you have any pain there? Okay, none. How about in your sinuses? Do you experience pain in your sinuses? Okay. Do you have any nose problems? Okay, like nose bleeding? Do you have any stuffed nose? Or did you have any changes in your smelling? Okay, so how about difficulty in swallowing? Do you have it, ma'am? Okay. Have you ever had oral, nasal, or sinus injury? Okay, so do you have history of infections? Okay, how about allergies? Do you have? Okay, none. Okay, do you have nasal spray? Do you use nasal spray? Okay, so did you have history of tooth grinding? Okay, none. So what was your last dental exam, ma'am?
None.
Never. You never had any
Yes.
dental exam. Okay, so is there any history of mouth, throat, side, nose, or nose cancer in your family? Okay, none. What is your daily oral, tooth, and dental care?
I brush my teeth 3 times a day.
Okay, so what is your usual diet, ma'am? Do you like cold foods or drinks?
Iced coffee.
Oh, do you like iced coffee? In a daily basis, how much iced coffee do you have?
2 times.
Two
per day.
times, okay. How about candies or sweets? Do you like it?
Yes. Chocolate.
Oh, chocolates. Do you have many in a day? That's so. Okay, so do you smoke?
No.
No. Okay, do you drink alcohol, ma'am?
Yes.
Okay, yes. In a month, how often?
5 times.
5 times in a month. So, before we proceed, ma'am, I will first conduct a hand hygiene and close the curtains for privacy. Assuming that I have already done the hand hygiene and closed the curtains, I will now put on the gloves to proceed to the assessment proper. Okay, ma'am, now that I have put on my gloves, I will now begin inspecting your mouth. Okay, so can you please open your mouth? Okay, can you grind your teeth? How can you bite down your teeth? Like this? Okay, I will now retract your gums or your lip to check your gums. So, ma'am, I have seen that your lips are somehow cracked or dry, but there is no present lesion nor it is swelling. It is also pink in color, which is normal, and with your teeth, I saw that it is yellowish in color, maybe because of the large quantities of coffee that you drink. It is also intact and aligned, and there are 29 all in all, with no decaying areas and no tooth missing. And it is also have smooth surface and edges. When biting down earlier, ma'am, your jaw was aligned and I haven't seen any deviations. When I retracted your lips earlier, I have seen that the color and consistency of your gums and cheeks are even. Your gums, as what I observed earlier, are pink and well moisturized, and it has tight margins to your teeth. I didn't also see any lesions nor masses when I checked it. Okay, ma'am, I will now continue inspecting your mouth. Can you please open it? Okay, I will use a tongue depressor, ma'am, to retract your lips and cheeks to check the color consistency. Okay, ma'am. When I expected your buccal mucosa, it was smooth and moist, and I haven't seen any lesions in your stensin duct. The one that drains your saliva, didn't observe any redness, and so it's good. So I will now inspect and palpate your tongue. Can you stick out your tongue, ma'am? Ma'am. Okay. Okay. Can you touch the roof of your mouth? Okay, I will now inspect your Wharton ducts, ma'am. Ma'am. Okay, ma'am. I will begin observing the sides of your tongue, and in order to do that, I will hold your tongue using this goose pad. This one, ma'am. Can you stick out your tongue, ma'am? Okay, the other side. Okay, ma'am. I will now check the strength of your tongue and its ability to taste. I will place my finger in your cheek, and please use your tongue to resist it. Okay, so ma'am, I will use this tongue depressor to test the ability of your tongue to taste. You can just say if it's sweet or salty. Okay, the first one, ma'am. Is it sweet or salty?
Sweet.
Okay, the other one. Is it sweet or salty?
Salty.
Okay, so perfect. Okay, ma'am, based on the data that I have gathered, your tongue is pink and moist and has little protuberances present. When I palpated its surface, there were no lesions present. And the ventral surface of your tongue was smooth and slightly pale and with visible veins, and no lesions were present. As for your Wharton ducts, I observed that the frenulum is in midline, and the Wharton ducts are visible on its side, with saliva flow or moistness in the area, and that it has no swelling and redness. Okay, so when I assessed the sides of your tongue, there were no lesions, ulcers, nor nodules present, and your tongue also offers strong resistance and you were able to distinguish between sweet and salty, which is good. Okay, so at this point, ma'am, I will begin inspecting your throat. Can you please open your mouth widely? Can you stick out your tongue more, ma'am? Okay. Can you stick out pa more, ma'am? Okay, so, ma'am, I observed that the hard palate is pale and it appears whitish, and it has firm transverse rugae or wrinkle-like folds. I haven't seen any signs of yellow tint, which is bad, but you don't have any. And as for the soft palate, it is pinkish, movable, and spongy and smooth. There was no unusual odor when I observed earlier as you opened your mouth. Your uvula, on the other hand, hangs freely and it's on the midline. Now, ma'am, I will inspect your tonsils. Again, ma'am, can you please take out your tongue? Can you... Okay. Can you swallow, ma'am? Okay, ma'am. I observed that, ma'am, they are pink. Your tonsils are pink, which is normal, and they are symmetric. There were also no present exudate, swelling, nor lesions. Okay, now, ma'am, I will begin assessing your nose. I will first begin assessing your external nose. Okay, ma'am, I will occlude your nostrils, ma'am, and okay, can you breathe, ma'am? Can you breathe easily, ma'am? Okay, you can. Other one. Okay, then did you find it easily to breathe, ma'am? Okay, so I observed that its color is the same as the rest of your face, and it has no reddening or such, and it is also smooth and symmetric, and I haven't sensed any tenderness, and you're able to sniff through each nostril while I occluded it. Okay, ma'am, so let's now proceed to the internal part of your nose. Can you please tilt your head back, ma'am? Can you open your nose widely? Okay, so, ma'am, the nasal mucosa appears to be dark, moist, and free of exudate. The nasal septum is intact and free of ulcers. The turbinates are dark pink, moist, and free of lesions. Okay, now ma'am, let us now proceed to an assessment of your sinus. Now I will begin to palpate your sinus using my thumb. Okay. Okay, ma'am, I have felt that your sinuses were non-tender when I percussed it. So, ma'am, that sums up your mouth, throat, nose, and sinuses assessment. All I can suggest for now is to drink lots of water to prevent your lips from drying or chopping. If you want to regain the whiteness of your teeth, you should minimize drinking coffee or tea. Okay, so I will recommend you to an oral and maxillofacial surgeon to further assess your condition, ma'am. And that's all for today, ma'am. Thank you for your cooperation.
Thank you.